We're seeing an increased interest in self-funded health plans. One of the big reasons is because of the new health insurance tax under healthcare reform. This is in essence a federal premium tax on top of state premium taxes. So it's made it that much more attractive for employers to self-fund because not only can they avoid the state premium taxes, they can avoid this new federal premium tax. Also, healthcare reform has a number of provisions that do not apply to self-funded plans. So employers that want to escape those provisions can self-fund and avoid those rules. Another big advantage is avoiding state mandates. Under ERISA, state insurance laws are preempted insofar as they apply to self-funded benefit programs. So self-funding means you don't have to cover all the things that a particular state says you have to cover. Also, control of your data. And data is very important. A lot of insurance companies don't provide data to smaller insured groups. Having access to data, you can figure out where your costs are going and make appropriate plan design changes if necessary, and you can also tailor your wellness programs. There are also disadvantages to self-funding. One of the disadvantages is cash flow. With insurance, you have nice, stable cash flow, so much per employee per month. With self-funding, you get peaks and valleys in the cash flow. Also, there's the risk that claims can be higher than expected. And also, there are additional administrative responsibilities. Insurance companies have more duties in a fully insured plan, and those get transferred to the employer. A lot of people used to think that self-funding was only for large employers, but that's not the case. Smaller employers, all the way down to 50 employees or even fewer, can self-fund their benefits. At that size, you almost always want to purchase stop-loss insurance to protect against high claims, either individually or in aggregate. And there are problems with that because a lot of states are objecting to smaller employers self-funding. And so some states have passed laws restricting the kinds of stop-loss policies that can be issued and making it less attractive for smaller employers.
Most important thing is that your duty is to the participants and beneficiaries, not to anyone else.
Who's running it, who's using it, and who's paying for it.
Fiduciary standards have some gray areas.
Have more contributions, more dollars coming in.